We want to talk healthcare because, Congressman, you're having a fundraiser tonight at the Petroleum Club, and members of the Dolores Huerta Foundation sent out a press release saying they plan to protest it. 3 people have shown up. How do you plan to vote for the public option at this point?
Well, I think what's more important is that we deal with the 30 million uninsured and that we provide cost containment, because if we don't fix Medicare and Medicaid, it will bankrupt our nation in the next 20 years. So my first priorities are to ensure that we provide fiscal responsibility to Medicare and Medicaid, deal with the 30 million folks that have no insurance, and then deal with preventive health care maintenance, pre-existing conditions, catastrophic events, and the situation that is critical toward improving health care in our valley.
I hear you basically prioritizing, it sounds like here, but yes or no when it comes to public option? Would you say yes, no?
Well, as I say, I think that is less critical to the package. The Senate has already said that they're not going to support a public option. And I think that the whole reason for focusing on Medicare and Medicaid and fixing this, a broken system, is to deal with the 30 million uninsured who have no insurance, and also to focus on the ability to get our costs in line with Medicare and Medicaid, because otherwise it will bankrupt our nation. We want to fix a broken health care system.
Now to the debate over health care reform. Congressman Jim Costa says there is more to it than just voting for a public option, but some of his constituents say that is the main issue. This evening, volunteers with the Dolores Huerta Foundation picketed outside a fundraiser he held in Bakersfield. 17's Ana Velasquez reports.
What do we want? Public option! When do we go in? Now!
Holding signs that read, "Your vote costs lives," and "Public option equals healthier citizens," members with the Dolores Huerta Foundation and the Kern County Coalition for Healthcare Reform picketed outside Congressman Jim Costa's fundraiser at the Petroleum Club Monday night.
We think that a government plan is the best plan, especially for poor people and for his constituents, because most of his constituents are poor people.
Congressman Costa serves the 20th District, which is in the San Joaquin Valley. The Democrat also serves on the House Committee on Agriculture, but he would not talk about his position regarding the public option.
My priorities is to deal with the 30 million Americans who have no insurance, who we're all paying a hidden premium, and 2, to be fiscally responsible to pay for Medicare and Medicaid. Now, whether or not public option is a part of an overall package, I think, for me, is less important.
Congressman Costa says he's also concerned with issues surrounding insurance portability, catastrophic health care events, pre-existing conditions, and preventative care.
I would like to vote for a health care reform package, but those are my priorities.
For the folks in the picket line, they just hope Congressman Costa considers theirs.
We want a public option. We want a health care plan that will not give everything to the insurance companies, but a plan that will protect the working people and the poor people of his area.
In Bakersfield, Ana Velasquez, 17 News.
Meantime, dozens of picketers gathered outside a fundraising event for Congressman Jim Costa tonight. The picket line was organized by volunteers of the Dolores Huerta Foundation, among others, to urge Costa to vote for the public option in the health care reform bill now being considered before Congress. Huerta says many made their voice heard today at the Petroleum Club as they urge Costa to vote for a plan that would also cover low-income families.
Jim Costa, a Democratic congressman, and many of these are his constituents that voted for him and asking him to vote for the public option.
Huerta says even with a government subsidy, low-income families still would not have the same benefits as others.
Now to the debate over health care reform and a push from the community tonight to get Congress to adopt a comprehensive plan. Close to 100 people turned out for a roundtable discussion this evening at the East California Church of Christ. The panel included medical professionals, seniors, students, clergy, and others who want lawmakers to quickly pass health care reform that includes a public option.
The government is accountable, right? I mean, the government has to respond to the voters. Insurance companies don't have to respond to the voters, so we have a lot more guarantees if we have a government health care plan than we do with the insurance companies.
Tonight's event was sponsored by the California Labor Federation.
Several dozen people gathered tonight in East Bakersfield to join in on a health care reform discussion. Good evening. I'm Chris Van Horn. Students, medical care professionals, and seniors made it out to the East California Church of Christ for a discussion on the need for Congress to pass a health care reform bill. The group says Bakersfield boasts one of the highest rates of uninsured people in the nation, with as much as 41% of locals having no insurance in Congressman Jim Costa's district. Those in attendance shared their personal stories to help explain the need for reform that includes high-quality health care with a low-cost public option.
It was very positive. I think a lot of people were very attuned to the suffering. We had a bunch of people come tell the stories of that they've experienced suffering because of the broken healthcare system, and I think a lot of people really relate to that and really understand that there needs to be a change because, you know, this community is really, really hurting.
With diabetes.
Organizers say a reform bill would provide insurance for 267,000 people in the 20th Congressional District, and more than 1,000 families would avoid bankruptcy every year, and nearly 10,000 businesses could get tax credits for their employees.
Healthcare was at the very issue of a forum tonight as local residents spoke out on the need for reform at an event sponsored by the California Labor Federation. Jose Gaspar was there, and he joins us now from Studio Control with that story tonight. Jose?
Lisa, that's right. You know, as the president's plan draws closer for a vote on healthcare reform, many questions still remain about what the final bill will look like, but proponents of the plan hope to garner public support.
Uninsured, roughly 267,000 people.
A panel of religious, labor, and medical personnel at California Church of Christ are pushing for passage of the president's health care reform plan.
This plan, while it's not perfect and there are going to be things that people have complaints about no matter what we pass, it's going to make a huge difference in the lives of the people here. From everything from actually providing insurance coverage to increasing funding for rural access.
I had good health care.
Matthew Cruz suffers from valley fever and depends on a $3,000 a month regimen for his medicines. While he has coverage, Cruz says that's not the case for others like him.
There's a whole lot of people that I know who have the same disease that I have, and they can't get this particular medication.
But supporters of the president's plan still have a long way to go. In fact, local Congressman Jim Costa, a Democrat, is not on board. In a statement, Costa said, "For any successful health care reform plan to pass for me, it must address the following four key elements: catastrophic care, portability, pre-existing conditions, and preventive measures." Costa's position is drawing rebuke from fellow Democrats.
And I think that if he doesn't do the right thing, then we've got to find somebody that will represent the constituents and not someone like him.
But most here are optimistic Congress will approve a health care reform plan in one way or another. For local attorney Kenneth Mason, he says it's long overdue.
We should be more inclusive in providing health to people instead of excluding people. I'd love to see the public option there.
Absolutely.
I think it's absolutely necessary to really have full, extensive coverage.
And proponents of the president's plan also have a postcard campaign going, which they say they will personally deliver to Congressman Jim Costa as a way to keep the pressure on and convince him to ultimately support the president's plan. Live in Studio Control, Jose Gaspar, Lisa, Kurt. Now back to you in the studio.
Jose, thank you.